as if it's a new person, so you guys know all the steps and you know what it's all about, okay? All right, so the first step that I'm going to do is the cleansing step. It's a mixture of glucosamine and lactic acid, and it's going to help to break up the dead skin on the surface. We're not getting suction. There we go. I got to turn it on first. That would help. Okay, so the vacuum suction on the machine is going to help to pull the pores open and shoot the solution down into the pores to clean them out really good. So this is a lot more advanced than your old school facials because it's getting a lot deeper in the skin and we're not just rubbing stuff on the surface. And it feels nice and cool and refreshing on the skin. I have patients who come in every 4 to 6 weeks to get this done, and it just helps to keep the skin nice and hydrated and exfoliated in between all the other treatments that they do. This will also help for any of your products to penetrate better because it doesn't have to fight through all the dead stuff in your pores to get down in there. How does it feel, Amy?
Like you said, it's very cool and refreshing.
Very cool and refreshing.
No pain, it's just, I don't know, it's just cool.
Yeah. So this is just going to help break up all that dead skin on the surface. And then I'm going to exfoliate it off doing a wet microdermabrasion, which I will do that in just a second. Okay, now I'm going to do longer strokes. This is just lifting all of the dead skin off to bring up the new, fresh skin. So a lot of times people feel like their skin's kind of dull, like they have, I don't know, just like it's not bright anymore. And this helps to remove all of that dead stuff so your natural glow of your skin comes through. There's no downtime to this facial. People usually leave the office. Sometimes they're a little pink, but that goes away in about 30 minutes. But most people leave and they just have a nice glow and their skin looks just fresh and tight. Okay, so the next step I'm going to do, first I'm going to switch my tip. That was the exfoliation tip. And now I'm going to switch to the extraction tip. And I'm going to use a little bit of glycolic and salicylic acid, mainly over the T-zone area where blackheads kind of like to hang out. And this is going to help to soften those up, so I can turn the vacuum suction up and do extractions of the blackheads.
You gotta love your job.
Yes. I love making people feel good about themselves. This part can be a little itchy or a little tingly. That's normal, just from the glycolic and salicylic, but it's nothing painful. Amy doesn't have too many blackheads, so she doesn't need too many extractions. Now I'm going to turn the vacuum suction up on the machine and do extractions over those areas. So this is just a stronger vacuum suction that just pulls those blackheads out, nice and gently. You have like no blackheads.
Really?
No.
I get those other bumps. I don't know what they are.
Yeah, it still will clean out any congestion in your pores, oil, dirt, that kind of stuff. Okay, so we're done with that step, and now we're going to move on to the hydration step. And I'm going to switch to skin and use my hydration tip. And I turn my vacuum suction down. And this step is going to infuse hyaluronic acid and antioxidants into the pores to hydrate the skin really well and to make the skin nice and glowy. So basically the first two steps we're taking out all the bad. This last step we're putting in the good. Putting in all the good stuff. The results of this last about 4 weeks. Yeah. Does anyone have any questions? That's it. That's the Hydrafacial.
Still.
We can check out the gun. Let's check it out. So on the back of the machine, there's a tube, as you can see. This collects all of the dead skin and the blackheads and the makeup and dirt and oil. So that is all the gunk. So it's really cool to see
how it works.
All the stuff come out because you really feel like I really did something good for my skin.
Yeah.
You can feel it and you can see it. So.
And it's still relaxing.
Yeah, and it's still